Hi, my name is Barbara McPherson. I'm a grad student at Grand Canyon University, and today I'm going to do a presentation over the functions of surfactant, pulmonary surfactant. But before we get into that, I want to go into a little bit about the structure and the function of an alveoli, which is where the surfactant functions at. So an alveolus is the functional unit of gas exchange in the lungs. Each alveolus is polyhedral in shape and resembles a cluster of grapes. Each alveolus makes up what is called the alveolar sac. The structure of the alveolus consists of thin walls made of simple squamous epithelial tissue. The alveolus in this site is the site of gas exchange. Alveoli cells consist of two types of cells, type 1 and type 2. We're going to talk about type 2 cells because those are the cells that produce the substance surfactant. That's what they do. Type 2 cells produce the substance surfactant, and they also can differentiate into stem cells, which would be able to replace damaged alveoli cells because they continuously do mitotic division. So now that we know a little bit about the structure that produces surfactant, we will now go in and discuss the functions of surfactant. But if you look at the picture here, you'll see over to the left, you'll see what looks like a bunch of grapes. And that is a whole alveolus. And then if you'll look to the right of that, then you'll see what it looks like if it's kind of cut open. And it will show the capillary, and it'll show oxygen going in and carbon dioxide going out, because that is the site of gas exchange. So now we're going to talk about what surfactant is. So surfactant is a biological substance that is produced by alveolar type 2 cells in the epithelial lining of the lungs. So synthesis of surfactant begins in the ER, or the endoplasmic reticulum, and is modified by the Golgi apparatus. Surfactant is stored in structures called lamellar bodies and secreted into the alveoli by a process called exocytosis. So that's just a little bit about how it functions. But we're going to look at the composition. This slide here will tell you a little bit about the composition of surfactant. So as you can see from the diagram, the pie-shaped structure there shows you the surfactant of lipids. There's 90% of those. And then there on the right, there is surfactant proteins, and there's around 10% of those. So surfactant proteins are lipids, surfactant lipids, they lower surface tension. They change and proliferate the cytotoxicity of lymphocytes. Also, and then the surfactant proteins enhance chemotaxis and phagocytosis. They also inhibit the growth of pathogens. So surfactant not only does it work within the lungs as to help, which we'll find that out in a few minutes, but it's going to reduce surface tension. It also works in your immune system a little bit. But on the pie chart over here, you see this big purple colored in here. I can't say these names. I can't pronounce them. I've tried and I've botched them very bad, so I'm not going to try it again. But this substance here, that's the main substance in surfactant. That's the one that does most of the job. And over here on the protein side, you can see that there are 4 surfactant proteins. There's protein A, B, C, and D. Proteins A and D are hydrophilic or water-loving, and B and C are hydrophobic. They're water-hating. They also have names too, but I cannot pronounce them. So that's the composition of surfactant. Okay. This slide here is just showing you a little kind of a picture of how in the cell surfactant is made. So what happens then is surfactant starts down here in the capillary, and it goes into the rough ER, or not the rough ER, well, it is rough ER because it's got ribosomes on it. So goes into the endoplasmic reticulum, and from there, this is where it is synthesized. Then it goes on into the Golgi for modification, and then from there, it goes into where it's stored inside these lamellar bodies. And then once inside these bodies, exocytosis will take place, and it will bring the lamellar body into the alveoli. Once it's in there, it unravels in here and forms a tubular mesh. Then that tubular mesh will come over here and form the monolayer that's over the air-liquid interface here. So as you can see here, these all kind of look like the phospholipid bilayer of a cell. So which they are. They have a head and the tail, a hydrophobic and a hydrophilic. So once they get into there and they form that monolayer over the air-lipid interface, then once they're done, they're just kind of degraded back into the body by alveolar macrophages, and then, that comes back in, the whole process starts over again. Okay, so the next slide we'll get into is the function. There's going to be several of these slides, but we're going to talk about the function of surfactants. So there are several functions of surfactants, such as it modulates an immune response and kills pathogens. But the main function of surfactant is that it lowers surface tension at an air-liquid interface, thus preventing the alveoli from collapsing and preventing the lung from collapsing. So you can see in this diagram, the picture over here that says normal expiration without surfactant, or I'm sorry, with surfactant. You can see that the airways are open, the alveoli are all open in here. Abnormal respiration without surfactant. You can see here that it's closed up here. They're all closed up, so they have collapsed. So what surfactant does is keep these airways open because it reduces the surface tension. Okay. This is all kind of done by pressure that you have inside and outside of the alveolar. So according to the law of Laplace, the pressure at the alveolar surface directs inward, which squeezes in on the air in the alveoli. So Laplace's law, the law of Laplace states that pressure in alveoli is directly proportional to surface tension and inversely proportional to the radius of the alveoli. So what that means is that pressure in smaller alveoli would be greater than it would in the larger if the surface tension were the same in both. So you can see that it has the P equals 2 times T divided by R, whereas P is pressure, T is tension, and R is radius. So we would say if two alveoli have the same surface tension but are unequal in size and are connected by the same terminal airway, what's going to happen then is the smaller of the two alveoli will collapse and empty the air into the larger alveoli. So this is what happens when the alveoli have no surfactant in them. Okay, so if the alveoli have surfactant, then the surface tension is smaller and the alveoli is reduced more than that of the larger. Thus, reduction in surface tension. So it changes the inward directing pressure so that now both the pressures, small and large, are comparable, and the small will not collapse into the large alveoli. So that's the law of Laplace. That's kind of what that's saying. And the next diagram kind of shows you that. This is without surfactant, the one on the left. So alveoli 1 and 2 have equal surface tension. One has a higher pressure due to the smaller radius, and it's more likely to collapse and be harder to inflate. But the one over on the right, where it's got the pink in it, is with surfactant. So one has less surface tension because it has more more surfactant per area. So 1 and 2 now have equal pressure due to the surfactant. 1 will inflate at a faster rate than 2 until they are equal in size. But these little notches around here, around the circle, those represent the surfactant. Okay, and then so how this works basically is, since surfactant is an amphiphilic molecule, which it has a hydrophilic head and a hydrophobic tail, that makes it both water soluble and oil soluble and water insoluble. So what happens is that surfactant diffuses in water and absorbs at the air, water, oil, water interface. So if to put that another way, the, the, the reason why surfactant reduces surface tension is because it absorbs the water molecules, breaking the bonds, which will reduce the surface tension. So this diagram kind of shows you the role of surfactant during inspiration and expiration. So during inspiration, when the alveoli expand, surfactant molecules move apart. But during expiration, when the lungs shorten, surfactant molecules move together and become concentrated, and then the surface tension is reduced. So those are the roles of surfactant. So now that we know how surfactant works in a normal process, we're going to discuss what happens to surfactant in a diseased lung, or in a case with such as a virus, such as COVID-19, and how it affects the function of surfactant. So this little diagram just kind of shows you what a healthy lung looks like, where you have normal gas exchange, you have the alveolar fluid, the air, the CO2 going in and out, and the surfactant here, and you got the cells at 1 and 2. And the V shows you a moderately infected lung, where you have reduced gas exchange because you have some swelling, some inflammatory responses. You have vasodilation of your capillaries. You have some macrophages here. You have protein down here in the fluid. And you have reduced surfactant because you have cytokines in there, and it's just not good. C is severely infected lung. This is where you lose all of the surfactant, which is it's gonna hinder the gas exchange a whole lot. At this point, you're seriously gonna need to be hospitalized. You're gonna need help because you're not gonna be able to breathe. But there was a study done by Wang, Li, Wang, Zhang, Go, and Shi in 2021 that the study was about how to treat COVID-19 with surfactant replacement therapy. So, and we have all been affected by COVID-19 in some way, but for this research, if they can find exactly how to use surfactant replacement, it could be a life-changing event for some people with this, with COVID-19. So research on severe acute respiratory syndrome, coronavirus 2, SARS or COVID-2, and surfactant replacement therapy is underway. So the SARS-CoV-2 virus, how it works is it damages the type 2 cells in the alveoli and decreases the production of pulmonary surfactant. So the SARS-CoV-2 gains entry into the lungs through a receptor called an angiotensin converting enzyme 2 receptor, or ACE2. and this receptor is on the lungs, and so the virus gets in through the lung, gets in on that receptor and attaches to it, and once inside the lung, the virus replicates inside the T2 cells, and that leads to the coronavirus. Um, the coronavirus symptoms are similar to that of acute respiratory distress syndrome and neonatal respiratory distress syndrome. Um, and so in this research, since there has been some success, so they've been some successful treatments of the neonatal respiratory distress syndrome using surfactant replacement therapy to reduce the surface tension in these patients. Since there has been some success, researchers are trying to replicate this process and use pulmonary surfactant to treat coronavirus. Um, there's going to have to be more research, though, is needed to determine how effective the treatment will be on patients suffering from coronavirus before um, it can be done. There's several methods that they're trying to do using bovine, which is like a natural versus synthetic, but they've had some success in it, but more research needs to be done to determine whether or not it's really going to be effective. But anyway, that's it, and I hope you've enjoyed the presentation, and thank you very much.